like to welcome you here this evening to the Heartbeat Trust. Certainly we'd like to apologise for a slight delay there. We just had some technical issues. They've been resolved now, so we're delighted to go ahead with this education session, which is part of a series. So keep an eye on the Heartbeat Trust website. You'll certainly start to see more sessions in relation to the Stop Heart Failure project. My name is Karen Craddock. I'm a specialist cardiac physiotherapist specialising in heart failure. So we're here this evening to talk about exercise and heart failure, and certainly how it will benefit you in managing your heart failure yourself. There's a few things that you need to consider when you're exercising, and I suppose with exercise most people find it quite difficult to get started. With heart failure there's a couple of considerations, and certainly one of the major issues that people have when they come to see us is in around fatigue and breathlessness. Okay. So it's important we may understand how energy is produced. So energy is produced in a number of ways, but the most efficient way is aerobically. And that really means that we use the oxygen from the air to produce the energy in the muscle tissue. Okay. So there's a few things really. So there's the respiratory system, the cardiovascular system, which incorporates the heart as well, and then there's the muscular system. They all have to work together to actually produce the energy nice and efficiently. As you exercise, you get fitter, and with that, your production of energy becomes much more efficient. There's a few things to consider. As you take the oxygen in, you're taking some nice deep breaths in through your lung tissue. So take a deep breath in there as you're sitting on the couch. I'm going to get you to stand up in a second, so just take a nice comfortable deep breath in there. And out you go. So there's a couple of theories in around the deep breathing. Some people would advocate taking a deep breath in through the nose and out through the mouth. Really what we say is whatever's comfortable for you. Okay, so I'm actually going to get you to stand up now, so you're going to offload your diaphragm and standing up. I'm going to get you to try a nice deep breath in. So deep breath in, and out you go. Well done. Okay, there's a couple of things with that breathing that you might find difficult if you've had heart failure, if you have heart failure. Quite often after your period of fluid on the lung, and the fluid is flushed out with the medication, you're left with this shortened breath. Okay, so you're breathing quite shallowly, continuously. Now the object of getting the oxygen in is actually to get it into the vascular system, so into the arteries and around into the blood. Now you can imagine as you're standing up, most of the blood actually pools to the middle, to the bottom part of the lung. So it's important that you're getting the oxygen into that area. So if you're breathing quite shallowly here, it's quite difficult to get the oxygen into the right area. So what we'll get you to do is just try that deep breath in again. Just be conscious of the base part of your lungs, so you're going to be more efficient in getting the oxygen in. So deep breath in for me, and out you go. And again, deep breath in, and out you go. Now what I'm going to get you to do is just start marching on the spot, and we're going to continue the breathing. And out you go. So now as I'm exercising here, this is exercise, marching on the spot, we're going to start to feel that the air is moving a little bit through the system. So deep breath in, and out you go. As you're resting, you obviously don't need quite a lot of oxygen because you don't need a lot of energy, but you do need to practice the breathing controls so that when you are challenging yourself when you're exercising, that you're able to take those nice deep breaths. The oxygen then heads into the bloodstream, which is carried in the arteries. And we find in somebody with heart failure that the arteries are a little bit sluggish. Okay, so it'll just take you that little bit of time to get going, and that might be the deterrent to you getting going yourself or getting up and exercising. So this actually can be fully reversed with aerobic training. So aerobic training is quite simple really. It's not an aerobics class, it's actually being more active, okay, and would constitute walking, swimming, cycling. So as you're standing there in your sitting room watching the telly or watching your desktop, we want to get you just marching on the spot there again. Okay. So now you're exercising aerobically. Okay. So what we're doing with that type of exercise is we're actually getting big flush throughs of blood through your system. Okay. So it's important you're sustaining that for a period of time, so you're sustaining a cardiovascular challenge. And when you're starting off with an exercise regime, it's important that you start off nice and gradually. So you're not going to go out today and do an hour's walk. If you're starting an exercise regime, we'd encourage you to go out and exercise for 10 minutes. Always being able to walk and talk at the same time, so we know that you're getting the oxygen in efficiently and you're processing it efficiently. The last part of the cycle that we mentioned is the muscular side. Okay, so it's important that you're strengthening your muscle as well as doing the aerobic training. There's no point in all this nice oxygenated blood carrying down to the muscle tissue and the muscle not being able to process it. Okay, so with the strength work, that will improve that function. But what we find in somebody with heart failure, that this can be compromised. Okay, one of the energy cells that produces the energy is called the mitochondria. And in heart failure, we find people have a reduced number of mitochondria, but also the structure of the mitochondria are compromised. Now with exercise training, so specifically strength training, we can actually reverse that. So once the oxygen heads into the muscle tissue, we can actually see that the mitochondria start to increase in their efficiency, but also in their numbers, so you're able to produce more energy. And that fatigue that you might be feeling will start to lift. It means that you're producing energy more efficiently and that you're able to process that nice oxygen that's coming through. Okay, so we're going to give you an example of some strength work, if that's okay. So the simplest one and the most efficient one is actually the squat. So for those of you who've met me before, you might be familiar with this, but we're just going to go through it again, if that's okay. Now, as you're standing up already, I'll just get you to balance either on a table or a chair at home. We're going to get you to stand feet apart, so your shoulder width apart, so it's usually about a foot apart there on the feet, balancing on the chair. The trick with this now is to stick the bottom out as if you're about to sit on a chair behind you, and back up again. Okay, so we're going to do 15 of those now. This lovely Tuesday evening, the hottest day of the year, and that's 2. Now remember, when you do these exercises, it's 3, 2, 1 down, and 3, 2, 1 back up. With heart failure, you have what we call a lot of sprint fibres. So they actually activate very quickly, but then they also tire very quickly. So you might find when you're doing something that you might start off great, and all of a sudden then you hit the wall. Okay, so it's important that you're doing this strength work, because this will actually improve that sensation and simulate what we call a slow twitch or postural muscle. So we're on 7 there now at the moment. So it's 3, 2, 1 down and back up again. And that's 9, 10, 11, 12, lovely, 13, 14, and last one there now, nice and gently. So you don't have to go too far down. If you have problems with the knees or anything, that will actually aggravate them, so you just need to be mindful that you don't want to aggravate any pain or anything like that in the knees. Yeah, I'll just move the slides on there for you. So your goal with exercise, well, you'll start off generally with the 10-minute exercise really, is you're going to be aiming for 45 to 55 minutes of exercise, which is probably a bit of a shock to some people. So there's a few components of the aerobic part of the exercise that you need to consider. So we do incorporate a 15-minute warm-up, and when I ask people what they think the warm-up is for, it's really to get the heart rate up and to get blood flow to the muscle. But one other thing that it does that you probably might not be fully aware of is it fully dilates the coronary arteries, and it does take 15 minutes to do that. So it means the exercise is nice and safe then when you move into your cardiovascular workout system. So then you pick up the pace after the 15 minutes into walk, talk, unable to sing intensity. Okay, so you're pleasantly out of breath, but you're still able to have a conversation with the person beside you. You maintain that for 20 to 60 minutes. This is your goal, so you're gradually, from 10 minutes, you're going to add in 5 minutes each week to gradually increase up your exercise capacity. At the end of your 20 to 60 minutes, what we're looking at is you're going to start to have to cool down. Okay, and again, you probably understand that that's to bring your heart rate down nice and gradually, but also there's a second element to the cool down that you might not consider. During your exercise training phase, you get a release of noradrenaline and adrenaline, which are what we call catecholamines, so they stimulate sometimes the regular beats of the heart. So it's important to cool down for 10 minutes so that you're actually just offloading the noradrenaline and the adrenaline. If you have 25 minutes to walk, we recommend that you just do a warm-up and cool down. Okay, and just add in, so once you hit 25 minutes on your aerobic training, you can start to add in 5 minutes with the walk, talk, unable to sing intensity. So we've gone through the squat already, so this is just a diagram, so this will be available on the website for you. So remember, it's 15 repetitions and 3 sets of 15 for you. Okay. So really the benefits of exercise, or if you have heart failure, there's quite a few benefits. Okay, but specifically for you, it's really to improve your energy, okay, so that you're able to do the things that you like to do, and we're starting to look at improving your quality of life overall. Okay. We also find if you complete an exercise training program that you actually reduce your risk of hospital admissions from heart failure, and if you are admitted, your length of stay is reduced by up to 3 days. So there's motivation for you to continue with your exercise. I think more importantly, it's to enjoy the things that you like to do, and to start to beat the fatigue element and the breathless element of heart failure. And when the doctors tell you that you're dry, that there's no reason that you're breathless, it's more likely related to your energy production system. So you need to look into your aerobic and your strength training. If you want specific exercise training, there are cardiac rehab groups available. So they're available nationally. The Irish Association of Cardiac Rehab is a national group that look at standards of practice in Ireland, and certainly they have a directory. And part of the assessment for the cardiac rehab sessions is an exercise test. So while we're giving you general exercise recommendations today, the guys in the cardiac rehab units can give you more specific guidelines on how to optimize your performance, to reduce your cardiovascular risk, but also to improve your energy production. You see the website here, www.iacr.info/directory. So I think that might be all we're going to cover today. Certainly, we'd like to thank you on behalf of the Heartbeat Trust team, and feel free to subscribe to our virtual education sessions. They'll be run quite regularly for you, and certainly feel free to contact us at any point if you have any questions. I'd like to thank you for taking the time this evening to join us on this lovely hot summer's evening, and certainly start off your exercise nice and gradually. Maybe walk up the stairs a couple of extra times today, and we'll start to work on your strength then as well. Remember, you've done 1 set of your squats already, so just 2 more sets today, and you can start the 3 again tomorrow. Thanks very much for your time.